to you a little bit about chronic care management before I pass it along for the rest of the slides. My name's Adam Lombardi. I am the Director of Sales and Business Development here at Amazing Charts. And chronic care management, for those of you that are not familiar with it, it's a new CPT code that was introduced that you can bill for non-face-to-face encounters for your Medicare patients that qualify by having 2 or more chronic conditions. As far as putting together this service for you guys, we did a lot of research and vetting different organizations that specialize in chronic care management and the documentation and efficiently getting that into your EHR where it's required to be qualified. We ended up vetting about 12 different companies and going through product demos, their client success rates, and various components to try and figure out who would be our best match. With Amazing Charts, I'm sure you guys are familiar with us having a high rating. We just had a new rating come out recently with WebMD putting us at the #1 EHR position yet again, and also having a price-friendly model for the smaller practice to get involved with. So a big part of our decision was finding a company that fit seamlessly with those 2 ideals. And through that research, we ended up coming across Caremerge, and Caremerge had high success rates, very efficient and easy to use, and beyond that, they had great knowledge and understanding of the chronic care management program. We started development on an integration between the 2 products, so it would seamlessly be able to transfer your documentation into the EHR. And we already have introduced an educational process where we'll get you trained and up to speed so you can start billing and getting paid and being profitable while also creating a great experience for your practice patients. Our hope with this is that your outcome would improve your population health. You'd be able to spend more time with the chronically ill patients. And through the use of Caremerge along with Amazing Charts, you should be able to provide better care plans and better outcomes for your patients. So with that, I'd like to pass it along to David Hunt. Dave is the head of business development for Caremerge and has vast experience with the chronic care management, and he'll be able to explain everything in detail.
Fantastic. Thank you, Adam. Good afternoon, everybody. Just checking out. Am I coming through okay here?
Sounds good.
Okay, great. So thank everybody for taking some time here. I know 2 o'clock in the afternoon for a lot of practices is a very busy time, so we do appreciate you taking the time. Chronic care management goes back to the beginning of 2015, and I've been doing talks for chronic care management since then. And I would always get this very deer in the headlights look about what was chronic care management. Was it really going to be something that took off? And I would often ask a room of 50 people or 100 people, how many people are actually working with it today, and I'd get 0 hands. As 2015 progressed and we leveraged the Caremerge platform for some early adopters, we started to see a few hands, single digits, come up in these presentations, and more people started to ask questions, although there was still a bit of the unknown, if you would. As we got into 2016 and participated in a few of the Pri-Med conferences with Amazing Charts, we'd see 5 to 10% of the room start to put their hands up, and lately, coming into this summer, we really feel like more and more now people are interested. They're seeing that it's sticking, and what we also have the benefit of is practices that have had success, and our ability to use those successes, learn from those, and share those with other practices that are now looking at what can we do to leverage the chronic care management platform with Caremerge and Amazing Charts. And Amazing Charts has been a fantastic partner for us in this, and it really makes a fantastic opportunity for offices that are using Amazing Charts to quickly migrate over to a platform that was built really for chronic care management as well as for collaboration between clinical staff members and patients in a platform that's very, very easy to use, as Adam had mentioned. So today we're going to take just about 25 minutes to walk through the platform and the slideshow here. One second. So one of the things I put out here in the first slide is just a feedback that I got a couple of weeks ago from a nurse, and in addition to telling me some stories about her patient population and a couple of folks that were taking their medications and pouring them out on the table and some of the interesting things that she was finding out, she was saying, you know, and it was amazing now that by making monthly calls and not just waiting till they came into the office for to see them, that they were actually finding things out that they could be very proactive about, that they could keep amazing charts up to date, that they could, you know, from a medication standpoint, that they could inform the physician in the practice about a change in condition that might have allowed them to do an intervention before something significant took place. And it just gave us their ability to, for all the time that she was a nurse within this practice, really start to be very, very proactive versus reactive to her patients' needs. So we're going to walk through what chronic care management is. We're going to talk about the CPT codes and the requirements. We're going to look at how do you implement chronic care management in your practice. And then there's a variety of questions that we hear each time that we'll touch on, but at the same time we're going to open it up for questions as well. So quickly, a couple key points to chronic care management. 2/3 of the Medicare population today would actually meet the requirements of CCM, which is interesting when we think about the total number of people, about 36 million. Of that piece, they have 80% of the older adults have 2 or more chronic conditions. And total number of patients worldwide, US, in the US, 36 million. And number of patients billed in June 2016. Now that, just want to make sure that's clear, that is through the beginning of CCM, January of 2015, all the way through June of 2016. 275,000 individual patients have been billed CCM under there for practices. So just to give you kind of the context of that, I know as of October of 2015, there were 100,000. So between October 2015 and June of 2016, it's about 175,000. So adoption is continuing to grow, but it's still in its infancy. Plenty of room to continue to roll out the program. And a lot of those on this call today, as well as those that we've recently signed up, are really at the beginning of this program too. So if you're sitting there wondering, have I missed out? You have not. There's still a lot of opportunity to go forward and to provide chronic care management for the patient population that's available. So what is the code? The code is 99490. It's for non-face-to-face time, and we'll talk about that. The average across the U.S. today, following the Medicare fee schedule, is $40 per month per patient. You see flexibility that I've seen in New York City, the high 40s. I've seen in other states into the 39 range. So there is it follows the schedule, and in most cases the average is $40. You might see in other presentations $42. When we've rolled it out to a variety of states, we feel safer with the $40. So today, what are some of the challenges? You have a very disconnected environment for the patient. There are a lot of the PCP, which we believe is kind of the quarterback for patient care, is taking on a lot more. You know, that particular patient has a variety of specialists, the podiatrist, the cardiologist, the rehab folks, the families getting involved. You have a variety of different payers. And in a lot of cases, that care coordination, although often very fragmented, falls outside of the control of the primary care physician. And so what CCM at its essence is, how do we allow that PCP to be a quarterback and be compensated for it? Because what I hear from a lot of practices, it's very, very difficult. It's from additional staff that's needed, from care coordination, from keeping the HR, from compliance. All of these things are issues, and yet the reimbursement continues to drop for PCPs, and the needs of that, their patient population continue to increase. So what are we looking to do? A Caremerge connected care platform. It allows individuals to collaborate. Although we see a really more office staff collaborating, but allows the PCP and the patient to be together versus separate and fragmented, and allows people to communicate in a way from a care plan standpoint, from time tracking in one location. So what does it look like today? You want to become the hub, right? And to become the hub, we need to understand what are the different conditions of the individuals there, and what are we doing to track the different tasks that are taking place today. And this is one of the things you'll hear me talk about a lot in this presentation, is that CCM is not additional work for your staff. It is functions that they're already performing. A individual patient comes in to see you, they go home, they have a new medication that you prescribed, and the daughter calls up or the spouse calls up and says, what is this? And a nurse or somebody, a member of your team, ends up talking to them for 10 minutes or 8 minutes or 5. Those are functions that you're performing today, and you're just capturing that time within our platform. So what are the core components? CCM capabilities. So it's a role-based permissions for the entire staff, so we know who can do what and who has to sign off on what. EHR integration, it streamlines the workflow that you have with Amazing Charts. It's easy to create custom to-dos and tasks for people, as a create a care plan for a medical assistant, to sign off on a plan for a nurse, to check medications, or to make a educational call or to return a call. All that can be captured within. Quickly track and coordinate at a glance, kind of on a digital dashboard. Collaborate with outside stakeholders. Any collaboration that takes place with another physician practice, another specialist, a rehab company, that dialogue, that time, and care coordination does track towards the CCM requirements of the non-face-to-face time for that month. Audit and analyze transitions, readmissions, any of that can be done within our platform. So it's a HIPAA compliant platform. It has the time tracking logs built directly into the system, so it's a ability to track that non-face-to-face time. We can see it. We can see in real time what's taken place. If I have 500 members or patients within my practice, and they're all CCM eligible, I have this ability to see, have I spent 10 minutes on somebody versus the other. I can run my comprehensive care plan. I can pre-build that, and I can load that into Amazing Charts, and I can actually update it and share it with the patient, print it out or share it with them. And I can provide access. So Amazing Charts, it's quality over quantity. There are a dozen of CCM options, as Adam had mentioned. And doing the due diligence with us, we're looking for an easy to implement platform, as well as a platform that individuals would find within a staff that it wasn't taking them a lot of additional time. As the one area as well is just the ability to capture on an ongoing basis the financial incentives for the chronic care management platform. Was one of the other pieces that we looked at as well. Is if it takes you a long time to implement it, if it takes the staff a tremendous amount of more time, you kind of lose the value of implementing the CCM platform. So what are the core requirements? You have to be a physician who can bill, an advanced practice registered nurse, a clinical nurse specialist, a physician's assistant. Now, only one provider can bill per patient per month. So there is a bit of a land grab in this environment today. By that I mean that we see the PCP being the main provider of CCM, but we also do see cardiologists and some other specialists that are actually getting involved as well. But only one provider can bill per patient per month. Today we don't see that as much of an issue due to the fact that there are so few people still billing, but as that percentage increases, we are going to see more and more where providers might find out that a particular patient is signed up with multiple providers. It is the provider that has the consent form first that is the one that will be able to bill on a monthly basis. Now, just because you can bill, there are other members of your staff that can actually track the time. So whose time counts? The physicians, the APRNs, the PNs, PAs, the RNs, the LPNs, licensed social workers, pharmacists, CNAs, and CMAs are all people that can bill within your clinical staff. So they're not bill, sorry, track their time within Caremerge. So collectively across that group, you're getting to the 20 minutes. So it's not just one physician hitting 20 minutes every month. It's not just one RN trying to get 20 months. It's the collective group of your staff within the practice working with each individual patient, whether it's 2 minutes for one particular member of your team or it's 5 minutes or 10 minutes, whatever it may be, the collective time throughout the staff on a monthly basis is what counts towards that 20 minutes. So CCM cannot be billed with the following CPT codes. So transitional care management, home health supervision, care plan oversight, hospice plan oversight, or certain ESRD services. We can expand on that a little bit as well. So what are just talking about some of the core requirements here. 2 or more chronic conditions, 24/7 access, 20 minutes of non-face-to-face time, a compliant EHR system, a physician, an overall care plan, and the consent form. I'll go into each one of those now individually. So 2+ chronic conditions. Just to give a few examples of this, CHF, COPD, diabetes, CAD, in the older adult Medicare population, it is absolutely something that takes place that you're going to find. So we're finding right now a kind of a rule of thumb is 60% of your Medicare population would fall into 2 or more chronic conditions. We're actually finding that that's a little bit higher, but as a conservative view, we take the 60%. 24/7 access to a care team. Many physicians are doing this today. This can also be outsourced at any given point to a third party. So access to that care team is including telephone or non-face forms of communication. 20 minutes of non-face-to-face care management. It must be contact initiated. This could be with a patient to doctor, patient to nurse, pharmacy to doctor, lab to doctor. And general planning time to coordinate care coordination does not count towards the 20-minute requirement unless it's initiated based on a contact or results in a patient or patient-related contact. So once again, I'm going back to these are many of the functions that each physician practice is handling today. And we find that when they start just to write down, I often tell practices when we first talk to them about CCM, take a look, on a scrap of paper, start to write down some of the things that you're doing, pick 10 patients and ask everybody in your office to do that. And over the course of a week or two, add up that time and you'll be amazed. It's often going way beyond 20 minutes. We see people going into the 30s and 40s. It continues to increase, and it's those small things that staff members are doing, and it just adds up. EHR certified, so today we're working with amazing charts, and as Adam had mentioned, outstanding ratings and customer satisfaction on the EHR side. So as we're moving forward, today we have some of the basic integration. We take the patient population out of amazing charts and we put that into Caremerge, so it's not duplication of entry for you. And then from a billing standpoint, our team's now working on getting the information back in, including the care plan into the EHR, as well as just the time tracking notes so we can be in full compliance. So patients have the ability to get successive routine appointments with designed primary care provider or a member of the care team. Today, I don't see in many cases that's an issue that anybody runs into. Updated care plan. We have a fabulous care plan in Caremerge. The ability to set it up so it can work across your patient population. You can customize it in any way that you would like. You can bring it in so that you have information by condition. You can have services that you want to provide and outcomes. So our care plan can be signed off and created on a monthly basis, or you can just update and edit it on a monthly basis. The benefit is it's in a format that the patient population or a family member, or spouse, or caregiver of that individual, the POA, would actually understand, and it allows you to actually talk to them about each of the objectives, each of the services that you believe they should be doing, as well as what you think that objective is, and then have somebody speak to them and count that towards your time. We're seeing a lot more interaction between patient and a staff member talking through the care plan, and that's just a real positive of the CCM platform. One of the key components is the consent form. We have a consent form. We customize it for your practice, although the bullets are all the same. The member has to sign off on the consent form, and the consent form has to be resident within your EHR. That allows us to make sure that we're documenting that they understand the elements of the program and that they're agree to work with you and your staff members on the chronic care management program. Very straightforward to do. We see single digits of folks that aren't interested in signing up. We actually have talking points for your office staff, and we work with them on a weekly basis to determine total members of CCM population that you potentially have, those that you're getting enrolled, and any gaps that you have in that process of being getting the enrollment done. So getting started, we have an assessment. We take a look at your practice. We determine how many Medicare patients that you potentially have, any issues that you have within the office, basic workflow analysis. Who is typically speaking? Do you have a CMA? Do you have what are your RNs doing? What are your LPN maybe doing? What are your physicians doing? Who would do the care plan? We're basically setting it up so we understand what is your workflow today and how could CCM be implemented within your practice. Our team will work with. We define a roadmap tied to your strategy and vision. How do you want to deliver chronic care management? We analyze and prioritize. We start consolidating, integrating info across the system, pulling the patient population from amazing charts, bringing it into the Caremerge platform, and then working with the kind of key individuals within your practice to help them move forward. So implement your CCM in your practice. As I mentioned, we have the launch, we align with the goals, the kickoff, and an ongoing optimization. We're constantly looking on a weekly basis with you, how are you doing? How do your care plans look? What has been the feedback from your patient population? What is the feedback from your staff? How does your staff think they could work with it better? We're constantly checking in and working to determine how the program is being implemented and where we can be more successful if we have any gaps in the initial implementation. So get in, get running, get going. So part of the whole goal here is to qualify. Sign up the patients, capture the data, bill for it, and kind of retain the continual information. As we had mentioned early on in the dialogue, we really want to keep it simple. We want to make sure that first and foremost, the goal is to provide better care coordination for your patient population. And secondly, it's to drive revenue for the practice so that they can continue to provide better care coordination, as well as just capture the revenue and capture for all the work and effort that's being put in today. So when we talk about qualify, this is just a bit of a recap of some of the things that we've talked about already. But we determine those eligible patients, run the chronic care management 2 or more steps, identify the best practices for enrollment. We sign up, we give you a chronic care management launch kit. It has step-by-step starter guide, CCM made simple packet, a brochure that you can work with your patient population, the consent form, and a CCM script pad. I joke about this a little bit. I have a practice that we work with where the physician has just been one of the early adopters, and he's done a fabulous job. He has just shy of 500 CCM patients on a monthly basis. His staff has been engaged. They really enjoy it. They have some wonderful stories about different dialogues that they have during the week with the patient population. And I asked him, how is it going? And he said, just it's going very, very well. And I looked down at his desk, and he had a bunch of notes that he was writing down. And I said, what are those? And he said, these are just some of the time tracking that I was doing while I was running around the office, and I was going to put it in. So we actually ended up coming up with a CCM script pad. Sometimes you don't have your phone handy. Sometimes you don't have a tablet handy. Sometimes you just don't want to write on the chart. So we give a little CCM script pad that people can walk and enter the notes later if they want. We want to make sure that we're working within the environment that your practice has. We want to make sure that not all the time is somebody on the computer or somebody on a tablet or somebody on their phone. So you can actually write it down and enter it at a different point. Just to give you a quick feel for Caremerge as a platform itself, the screen up to the right side there is the way we track the time. So we've already pre-built our time tracking components. What we have is little indicators of spoke to a POA, spoke to the patient about medications, updated a care plan. You don't have to type it in every time. We've built Caremerge in such a way where it's very intuitive. So you can set this screen up just as you would like, and it allows you to just click on that and it automatically pre-fills it, and then you can just drop in the amount of time that you had. So in this case here, it would be 10 minutes or 15 minutes, and it's tracking it throughout your staff. The second slide there is our care plan. We can pre-build the care plan library, and you can go from that library COPD, diabetes, and you can adjust it patient to patient in such a way where the services that you're going to have or the outcomes that you expect are individualized for each patient, but you're not having to recreate it every single time. So we have a very dynamic library. So one of the things that, the follow-ups to this webinar would be those that are interested working with the Caremerge platform with Amazing Charts is to reach out to your Amazing Charts salesperson, and we'll schedule a demo and really get into the inner workings of Caremerge here and show you these screens. And you'll recognize that our training sessions last less than an hour because the system is very, very intuitive and easy for practices to use and to pick up. So I just want to show you a little bit about Meet Irma. She has 2 or more chronic conditions. She's not compliant or inactive in her own care. So in the month that we were tracking her, she had 8 minutes call with the patient and the POA, medication reconciliation. She had 7 minutes of care coordination with the specialist. She had 10 minutes review and approval of VNA orders with the communication with the VNA staff, and she had 5 minutes of physical therapy referral that was put together after they realized that she had a recent fall. So in this particular month, it was 30 minutes. If we look back over the last 3 months with her, she's averaging about 23. But as you can see, each of those elements that were tracked were done so by different members of the staff, but collectively coming across in that month's billing, they had 30 minutes for her. So one of the things we have on the billing side is you can track time tracking in real time. So the integration with EHRs and Caremerge provide real-time dashboards for you. So you have this ability to look at what percentage of my patient population has hit the 20 minutes, what percentage of my patient population is at 18 minutes or 19 minutes, and it allows you to kind of determine whether or not you should go in and do some more to bring it over the 20 minutes, or if your staff, you have certain staff members that are just spending way beyond 20 minutes, they're in the 30s and 40s. And so it's really giving you a real-time understanding of how is your staff being utilized. So we currently, today, when we bring the information over from Amazing Charts, we're tracking it through the Match the Patient Record ID. We have the single sign-on environment, automatic export of the time tracking in the care plan. We're flowing that back into Amazing Charts, and the trigger billing based on the minutes that are spent. So some of the information, physicians can engage and satisfy communication needs of patients and their family through a patient and family app. Offices can share notes and care plans automatically and electronically to support compliance and CMS billing requirements. Solution provides physician office staff and the ability to engage with patients and families 24/7, CCM compliance requirement. These are just a few of the things that we want you to walk away. Our application today, working in real time, has allowed practices to begin with CCM in 1 month, and by the following month they're already getting their consent forms, their patient population signed up, and they can actually begin to bill in a very short time frame. This is not something that needs 6 months or 9 months to really get everybody up to speed. This is an application, an opportunity to get moving very quickly. Just to give you a quick sample of the ROI, is if you have 1,500 patients, 60% being Medicare, 50% qualified for CCM. I'm being very conservative. It would be 450 qualified CCM patients. At a $40 PPPM per patient per month, 18,000 monthly, 216,000 annually would be going back to the practice. What we're finding today is a lot of the practices we're working with are somewhere between the 300 to 1,000 CCM eligible patients. Here, you're not going to get everybody to sign up, but that's going to be a very small amount of people that do not. You're not going to get 20 minutes on everybody every month. There are people that are in the hospital systems. There are people that are, you just don't get them on the phone that month. They're right. but it is very reasonable to think that 60% of your Medicare population would qualify. 50% of those folks would qualify for CCM, and we find it's very worthwhile for a practice once you get over 150 to 200 CCM eligible. Then you start to have meaningful revenue. So there's two models that we provide. The first is a Caremerge provider model. In that model there, we're training you on Caremerge. You're bringing Caremerge up on a daily basis. Your staff is using it, and you're billing. Tracking time and billing, developing the care plans, working with your patient population. That is the majority of our practices today. As we've continued to roll out CCM, we find practices that say, from a bandwidth standpoint, I may not have the bandwidth to actually engage this right now. We've added a Caremerge provider premium model in which we leverage a telehealth staff, a telenursing staff. And so our team will work with you on site for a short amount of time, and then we work remotely with the patient population to track the time, to work on their care plans, and we collaborate with your staff to make sure that they understand what we're doing around the monthly. We're updating your EHR, we're remoting into amazing charts, and we're actually following, on a monthly basis, any updates that we can provide into your EHR as well. Whether we're talking with the patient, we come up with a different medication, or we find out they're using a different medication, or they haven't refilled the medication, whether they had a recent fall, whether we walk through the care plan and make sure they understand the education elements, what they should be doing, what some of the expectations are. And then we share that with your staff. So once again, two options: the Caremerge provider model, in which you're leveraging our technology and the integration with amazing charts within your practice and leveraging your staff. And then the Caremerge provider premier model, where you're actually outsourcing it to our team as a third party, and we're managing CCM for you. So with that, before we open it up over to Q&A, I'll just actually turn it back over to Adam. I know there'll be a few different questions that come through, but one of the key components that we want to make sure everybody walks away with today is that there's an opportunity to really provide better care coordination. I think everyone has recognized that physician practices today spend a lot of time managing a patient's care, and as reimbursement has dropped, they haven't been compensated for that. CCM really does allow a practice to provide better care coordination, while at the same time it allows them to generate revenue in which to manage their staffs that they need for this coordination. And we've just been very, very happy and very thrilled with our opportunity to work with Amazing Charts. And I found that as we continue to build out our application between the two companies, we're helping practices really tackle this opportunity in a fabulous way. So, Adam, I'll turn it back over to you. I know there's probably going to be a few questions, and I'll allow you to receive those.
Thanks, David. And just so you guys know, everybody that is registered, whether you were able to attend or not, will be receiving a copy of this webinar as well as the slides that were shown. And if you do have questions or you'd like a more one-on-one detailed demonstration of the product, the features, the services, you'd be able to reach out to any member on the sales team at 866-382-5932, and extension 2 will get you a member of the sales team. And I don't see any questions coming through just yet, Dave.
Okay, we'll give it a couple minutes. I think.
Okay, I got one here. I don't know if we covered this. Are there costs associated with the service?
Yes, there are. As I mentioned, there are two models that we looked at. The first is the allowing the practice to use I'll go back to that screenshot for you. Allowing the practice to use the Caremerge application integration with Amazing Charts. In that case there, depending on the size of the practice, we're charging a license fee per patient per month, and that will range anywhere from $8 to $10 per patient per month. And at times we do have practices that are exceeding specific levels of CCM patients, so we also have opportunities where we've decreased that cost as well. In the Caremerge provider platform model, we're actually charging $24 for that. Our entire staff is handling, that's per patient per month. Our staff is handling all the CCM elements, supporting getting the consent form signed up, collaborating with your staff, collaborating with some of the other providers that you work with, reaching out to the patients and looking through medications, updating the information in your Amazing Charts, as well as tracking all that time in Caremerge and developing the care plan. So it's a great opportunity for those practices that don't feel they have the staff today, maybe understaffed, may have had some recent turnover, would really like to do the CCM model and just feel at some point they'd like to take it in-house, but they want to get started today. In that case there, that premium model allows us to do that. There's still a great opportunity to drive revenue even in that model. We find practices, depending on the reimbursement, are taking, even after the copay, $10 to $12 back per patient per month for that. Clearly, what we're having tremendous amount of successes is with the Caremerge provider model, where the providers have a dedicated staff member as well as a few other staff members that are capable of doing it in-house. In that case, they're maintaining the bulk of the reimbursement.
Great. And then you just touched on it a little bit, but somebody asked how much time should they plan on for implementation, and what additional support will they need to add in their office to complete this?
Yeah, great question. The implementation for us, we strongly suggest everybody take some time after this call to schedule a demo with your Amazing Charts staff, a sales team. Demos will take 20 to 30 minutes. We often tell practices it would be great to have the physician available, if not the office administrator, and maybe one or two of the folks that would actually leverage the system. As I mentioned, that's 20 to 30 minutes. Once the practice decides to sign, the contract with Amazing Charts is fairly simple to put through, and the training takes about an hour. And then we do weekly follow-ups. We'll schedule a weekly follow-up to make sure that we're tracking towards kind of key performance indicators that we agreed to in that initial implementation. And those are, we recognize that you have, as an example, 500 CCM eligible patients. We've taken those from Amazing Charts and put them into Caremerge. What would be your objective over the first 60, 90, 120 days? And in a lot of cases, folks will say, I'd like to get to 100, and I'd like to get to 200, 300. And we work with you each week to make sure that you're tracking towards those performance indicators. In addition to that, we're also looking at your care plans. How could we help you improve those care plans? We're looking at your time tracking. I've seen cases where practices will go in and somebody will put 1 minute for everything they do, when in a lot of cases it wasn't a minute, or they constantly ending up at 10 minutes for every single patient that they're working with. We'll go in and say, well, are you tracking this particular function? Are you tracking that particular function? So we are invested with each practice to make sure you're successful. This is not a sign up and leave, specifically in the Caremerge provider model. And in the Caremerge Premier model, we are to absolute making sure that we are implementing extremely quickly. And in that case there, your time with us is just collaboration to make sure that you like the care plans that we're doing, that we're getting the consent forms signed up, that we're managing your patient population the way you would like us to.
Great. Okay, I got another one for you that definitely be in your field, Dave. In the last year that we've been offering this, what have we found as far as the likelihood of patients or families to sign the consent form?
Well, I can tell you, of all the practices we have signed up, I don't have an exact number. It would be difficult to get to, But in talking with every single one of the practices that is using our system today, it is less than 1%, and that's probably high. It's you know, they trust in the physicians that they're meeting with. They believe that the additional care is going to be very beneficial for them. They welcome the outreach. They welcome the knowledge. They welcome the education on particular conditions. I've sat next to individuals that are speaking to patients as part of the CCM platform. There's just a wealth of knowledge that's captured, and it's on both sides. It's the benefit to the practice, but really the benefit here is to the patient.
Okay. Another question came in. Can any of my office team members' time count towards the chronic care management?
Your admin office staff does not. You can have them enter information as long as you're capturing it, if that helps. So as I mentioned, the CCM script pad. I've seen physicians write some notes on a chart and have an admin enter it in. But if we go back to a few of the slides, I want to make sure that folks recognize there are individuals specifically within your practice that would allow for that time to be tracked, and that is the physician, the RN, the PA assistant, an LPN, a licensed social worker, or pharmacist, the CNAs or CMAs.
Okay, great. Now I know you touched on part of this in the beginning, Dave, but somebody asked how many physicians can bill for chronic care management on an individual patient?
Okay, yeah, so it's one physician per patient per month, and yeah, I mentioned early on it is a bit of a land grab. There is not a mechanism today with any of the CMS websites to find out who signed up with who, and so we do have a situation today where somebody might bill and be denied because another physician is actually billed for that particular patient for CCM. I can tell you I've only seen that happen twice so far, all the patients that are billed. But it is one patient. It is often the primary care physician. In a lot of cases, we can send a copy to folks on this call along with the deck to talk about what's on the consent form. The consent form does say to the patient that you can only sign up with one physician. We all know that some mild cognitive impairment is in a lot of this patient population. There's people forget if they sign something twice, but in many cases we do not see people signing with multiple providers, but they can only sign with one, and only one can bill.
Okay, great.
I can mention too, Adam, a couple things we're seeing going forward is that we do see as additional time is added, we're seeing increases in reimbursements on the slate. We are seeing opportunities, moving forward where folks are using our platform to just connect more to their patient population. To provide some nutritional information as part of the care plan. We see them providing additional documents that would typically just be a printout or typically be something that they would vocalize specific to a function like a diabetes or COPD or CHF. And so using our platform to become more kind of integrated with their patient population is something we're also seeing now too. And initially, all we've seen is really time tracking, care plan development, working closely with the HR to capture that information and billing for it with those calls with the patient population. As we go forward, I see more and more people using CCM as a platform for far more integrated care plan oversight.
Great. And Dave, if you could just tell me if I'm right on this. I've told quite a few people that this chronic care management is similar to with meaningful use. It's an incentive that's provided to people that are seeing a heavy Medicare population, and it's Medicare trying to avoid people having costly hospitalization care and trying to prevent things before they happen, and in return they're paying this extra stimulus money basically to the providers that are playing part with that. Would you see that the same way?
Yeah, I do. I see, we all know reimbursement's continuing to change. They're looking at everything from readmissions to they're looking at, total cost of care, outcomes. I just see CCM as kind of a foundation for some of these things going forward. And, it is definitely an incentive for physicians. There's definitely, it's not a difficult program to roll out, specifically when you have a collaborative like Amazing Charts and Caremerge working together. It is, especially the amount of effort we put into to help the practices. It's in our best interest as well to see the practices successful. Specifically based on the way that we've structured the system and the partnership. So it is absolutely an incentive. I think the physicians I've talked to and those that have been talked to actually quite surprised. Those, especially some of the early adopters that are now billing $15,000, $20,000 a month for functions that they were already performing. That's a nice conversation to have with a physician where 3 or 4 months earlier they were saying, I don't know if we can implement this, and then you're sitting down with them and they're like, yeah, this is actually working. We're capturing a lot more information. Our EHR is more up to date. I have more information when our patients come into the practice, or I have more information from a house call doctor when I'm going out to see them. Because we are constantly having that reach out each month. And I think that's been one of the real nice pieces of CCM, and I think why it's going to continue to gain in its adoption.
Great. All right, perfect. And if there were any questions that anybody typed in that weren't answered in this webinar, we will be reaching out directly with answers to each of you. I would expect to probably receive an email from somebody from my department in the next 2 days. Monday's a holiday, Tuesday possibly at the latest. And they'll offer time to schedule a call, one-on-one, a product demonstration, and if you want to move forward, they'll help you out with the implementation and get you scheduled for your first training. And just as a reminder, if you do want to call us before you hear from anybody, the number again is 866-382-5932, and extension 2 will get the sales department. If you want to reach me directly, my extension is 3364. And feel free to contact me directly as well. Okay, and with that, I guess we will wrap up for today's webinar. And I thank all of you guys for attending and giving us the time on a Wednesday afternoon. And I hope this was educational and beneficial to everybody.